Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them like a sonic boom. Today, we learn about the Retroviridae, viruses that sneak their RNA into your DNA. Try these cues before we start. Which retrovirus can directly cause cancer in humans? Which ones are associated with cancer indirectly? Let's begin. Retroviruses are enveloped icosahedral viruses with a diploid, positive sense single-stranded RNA genome. Their reverse transcriptase copies their RNA into human DNA. The host cell then uses that DNA to build more viruses. This integration promotes lifelong infection. Human-infecting retroviruses are grouped into lentiviruses and Deltaretroviruses. Lentiviruses comprise human immunodeficiency viruses 1 and 2. Both have extra genes that help them hide from the immune system. They can infect both resting and actively dividing cells, slowly weakening the immune system over time. HIV 1 and 2 share key virulence factors like reverse transcriptase, glycoprotein 120 for CD4 binding on CD4 plus T cells, and glycoprotein 41 for fusion with membranes of immune cells. But HIV 2 replicates more slowly and mutates less. Both spread through sex, blood, needles, mother-to-baby transmission, and breastfeeding, though HIV 2 is less efficient. HIV 1 mainly affects men who have sex with men, sex trade workers, and people who inject drugs. It's common in areas with high infection rates worldwide. HIV 2 mostly occurs in West Africa and among the partners of infected people. Both cause a flu-like illness lasting 2 to 4 weeks. Symptoms include fever, rash, swollen lymph nodes, and fatigue. Then the viruses enter a long latent phase. HIV 1 typically stays hidden for 8 to 10 years. HIV 2 progresses more slowly, remaining latent for 10 to 15 years before significant immune problems develop. HIV 1 causes profound immunodeficiency, leading to acquired immunodeficiency syndrome, marked by very low CD4 plus T cell counts. The main complications are shown on the screen. Severe immunosuppression indirectly increases the risk of cancer, notably Kaposi sarcoma, though other malignancies can occur. HIV 2 has similar but milder effects. It causes slower immune weakening, fewer complications, and a lower risk of AIDS-related cancers. Both are diagnosed using fourth-generation antigen antibody tests. PCR confirms HIV 2 due to lower detection sensitivity during early infection. Viral load testing measures how much virus is in the blood, showing disease activity and treatment effectiveness. Both are treated with antiretroviral therapy, usually combining nucleoside reverse transcriptase inhibitors and an integrase inhibitor, but HIV 2 may show some drug resistance. Condoms, pre-exposure prophylaxis with daily antiviral pills, post-exposure prophylaxis with a 28-day course, and screening blood products prevent both infections. Treating pregnant and breastfeeding moms with HIV protects their babies. Next are Deltaretroviruses, which include human T lymphotropic viruses 1 and 2. Both replicate slowly, relying on the multiplication of the T cells they've infected. Both make proteins that quicken human cell division, which can cause cancer. HTLV1's tax protein is strongly cancer-causing, but HTLV2's tax is weaker, making malignancy less likely. Both produce HTLV basic leucine zipper protein, which helps infected cells survive and multiply. Both spread through breastfeeding, sexual contact, and blood, though HTLV2 does so less efficiently. HTLV1 is common in Japan, the Caribbean, and Africa, often passed to infants via breastfeeding. HTLV2 mainly affects indigenous groups in the Americas and people who inject drugs. HTLV1 can stay silent for 20 to 30 years before causing disease. It can lead to adult T-cell leukemia or lymphoma and HTLV1-associated myelopathy, presenting as aggressive leukemia and spastic leg weakness. HTLV2 is usually asymptomatic, though it can rarely cause mild leg weakness, sensory changes, or bladder problems decades after infection. It has little or no link to cancer. HTLV1 is diagnosed with antibody tests and confirmed by Western blot or PCR. Treatment is supportive, with chemotherapy for adult T-cell leukemia. Prevention includes counseling, avoiding breastfeeding by infected mothers, and screening blood. HTLV2 uses the same diagnostic and preventive measures, but usually doesn't require treatment. Let's review. Which retrovirus can directly cause cancer in humans? Answer: HTLV1. Which ones are associated with cancer indirectly? Answer: HIV1 and HIV2 through immunodeficiency. Flawless streak. Exhilarating. Learn something? Smash like, share, and subscribe. Scan the summary table in the description. Thanks for watching. Stay aboard Med in 5 for more high-yield med clips.